Hi ladies, it's Dr. Scherbel. Happy Easter. I wanted to take the opportunity to show off my beautiful dogwood tree, which is blooming right now. We only get it for a few weeks every year and I just love it so much, so I wanted to share it with you. I want to talk today about a topic that comes up several times a week, which I think is really interesting, and that's about pregnant women asking me if they should collect their colostrum before the baby's born to give it to the baby at birth. And I wanted to talk about, because I think it's really odd that so many people are asking me about it. So it must be on social media. So I just wanted you to hear from Dr. Scherbel what I think about that. Number one is most women are not making colostrum. So to be clear, colostrum is the first milk that we make when a baby's born. Most women are not making any colostrum at all until the baby is born. So if you're pregnant, you shouldn't necessarily anticipate that there is colostrum coming out. It can occur a couple days before the baby's born, but that is not typical. Typically, there is nothing happening with your nipples until this baby comes out. And you know, if there was colostrum coming out and you wanted to collect it, that would be fine, but I wouldn't go out of my way to try to do that. And here's the reason. Colostrum is not milk. It is distinct from milk. Colostrum is a substance that all mammals make. It is created at the time of birth, at the first contact with the baby in the first couple days of the baby's life. And it's particularly a nutrient-rich fluid that has sugars, proteins, white blood cells, immune factors, and it is distinct from milk. Milk is separate. It comes in about 72 hours after birth. I'm always talking to women about it because they get nervous that their milk hasn't come in, and kind of like on the third or fourth day of life, of the baby's life, a mom will wake up with these really engorged breasts, and that's their milk. That's called lactogenesis in the second stage. But colostrum is this very specifically nutrient-rich fluid that is made at the time of birth to sustain the baby for the first couple days of life while we're waiting for the milk to come in. In fact, having the baby suckle and excreting the colostrum out helps us make our milk. So I just want to say, when patients ask me, I always say, well, it's not something I would go out of my way to do. I would not go out of my way to pump and try to collect colostrum, because I personally want the colostrum there at the time of birth, because that's when the baby needs it. It's got all the immune factors the baby needs. It's got a lot of protein and sugar that the baby needs at birth. So I'd rather have the baby have colostrum at birth than thin milk. So I wouldn't try really hard to stimulate my breasts or nipples and pump colostrum. Now, if you happen to be secreting it anyway, I guess you could go ahead and collect it. It would be good to give the baby, but I wouldn't make a big effort to do that. It also has this amazing effect where it has laxative effects. So colostrum, by the baby drinking it, it actually has a little bit of laxative, and it can help prevent the development of jaundice. So colostrum is a great nutrient for our babies at the time of birth. I would not go out of my way to collect it. I want to mention a few things that can help with milk production, which I practice every day when I deliver babies. But number one is skin to skin. It is the goal to deliver the baby and put the baby right on the mom's chest, skin to skin, and I'm always taking my patients' gowns off. I'm trying to get that baby on them as soon as possible. That facilitates bonding, and the baby will naturally kind of start rooting and looking for a nipple to suckle. It's amazing that their little brain stems have this instinct, and then a mom has this instinct to allow the baby to suckle. So skin to skin, especially for the first hour after birth, is something I practice all the time. I do not want the baby to leave the mom. There are times that has to happen, but in general, the objective is that the baby is born and immediately put on mom's chest, and skin to skin is facilitated. I often encourage dads to do skin to skin later, but mom goes first. Another thing that can really help with lactation and the production of milk is literally to have your baby stay in your hospital room. So of course, rest is very important. So periodically we'll send the babies to the NICU so mom can sleep. But the hospitals where I deliver at, it's common practice that we keep the baby in the room, because we know that facilitates lactation and breastfeeding kind of on demand that can help your milk come in. I want to make this big point to say that breast milk is wonderful. It helps with bonding. It helps the immune system. We should breastfeed for at least 3 to 6 months. kind of think that at 6 months, the immune system of the baby is pretty well set, but by breastfeeding, we give the passive antibodies from the mom to the baby, and it can really keep the baby healthy. But there is not enough vitamin D. So if you're a breastfeeding mom, it's really important that you supplement vitamin D in the baby. Give these little vitamin D drops that you can ask your doctor about. And then I want to give a shout out to the girls that don't like to breastfeed. So I have seen all different patients, and I want to mention that there's a lot of women that don't want to breastfeed. I'll say what my sister says. She thinks it's weird. Okay. And I personally love to breastfeed. I think it's a really great bonding moment. It gets the oxytocin flowing, but a lot of women don't like to. And I understand that's a common thing. So a lot of times those women choose to pump their breast milk and give it to the baby. And that's a way to get the baby the healthy breast milk without having to do something that might make them uncomfortable. And then there's moms who, for whatever reason, maybe they can't make milk or they don't want to pump. And then we have formula. And ladies, there's nothing wrong with formula. I always say my mom gave me formula. I turned out okay. I always say I'm a doctor. Maybe I could have been a neurosurgeon if she had breastfed me. I don't know. That's my joke. But I'm very, very close to my mother. I care for her. I'm very, very close to her. We're very bonded. I'm a very healthy person, and we're very close socially. So, no shame about formula. We do try to encourage breastfeeding, but if you're somebody who doesn't want to, it's perfectly fine to have your baby on your skin, can still bond skin to skin, give your baby your formula. And sometimes I've been the patient who hasn't made enough milk, and I would make a very conscious effort to put my baby on my skin for months even. I will take my shirt off, put my baby on my skin, and I give my baby my bottle formula, and I'm looking in my baby's eyes, and we are bonding very closely while I give the baby formula. So giving a baby formula doesn't mean you can't bond with your baby. There's lots of different reasons to give formula. So just shouting out that there's no shame in formula. I always say formula never killed anybody. The goal is to feed the baby. And one last thing before I go, I'm into pacifiers. Sometimes babies just want to suckle. There's this whole discussion about nipple confusion. But if your baby gets latched and you feel like your baby's nursed a couple times and it can take your nipple, then give them a passy. There's a reason it's all over the hospital. Anyway, I'm Dr. Scherbel. I have lots of thoughts about breastfeeding. If you have any questions, feel free to reach out. This is my Facebook page. If you have any topics you want me to talk about, you can just write on here. And I hope everybody has a beautiful spring day like me. Take care.